Pleasure to be with you all today, too, as well. And thank you for the mic, because I don't like standing in just one place. I want to be able to talk with you guys. Today, I want to be able to have a conversation. Mainly, I want to be able to influence you all. A lot of you don't know me, but some of you do know me in the room. So I just want to start off with actually skipping this screen for the sake of time and just keeping it on this screen. There's no words. This is just a picture of me. This is at age 22, getting sentenced to an 8 to 12-year sentence in state prison. I'm going to actually share more details. I know we talk about prison time, things that we've done. I went to prison for shooting somebody at a gas station. So I went for attempt murder, shot somebody that looked like me, was around the same age as me, and could have been my friend, could have been my brother, but I shot him because of where he came from and where I came from. I'm also from New York, so I'm not from Illinois, but we'll learn why I'm here and the data I have and what I do so that you can understand why I'm here to talk to you guys. So this is me at age 21 in 2012, getting sentenced to an 8 and 12-year sentence. Again, my sentence was for attempt murder. I was fortunate enough to be able to get a $100,000 bail and fortunate enough to have a family that bailed me out. And when I bailed out of jail, I actually didn't change my life. I said, you know what? This was part of the journey anyway. Jail was part of this. I already had this in my mindset that living this lifestyle, I'm going to be in jail or be dead anyway. And I was okay with that at 19 years old. I think a lot of people in that life were okay with that. So I got out on bail, did some other crazy things. In about 6 months, police came to my door and locked me up for indictment. They said, hey, we was already going to lock you up regardless. We know you're out on bail. We was going to lock you up anyway for an indictment for your whole hood, the whole gang stuff that you guys are involved in. So now I was in there for attempt murder and racketeering, all these kind of different crimes, and no longer 8 to 12 sentence, 10 to 15-year sentence. Right? And that's really where it stung for me, because I was sort of seeing myself getting out at 35 years old, 36, and I went to prison, right? Went to prison, lost my mom while I was actually going in jail, about to navigate, get out of jail, and send me up to state prison. My mom died at that time. I didn't have a father. I got one of those regular childhoods we hear when we speak to young black men. My dad, don't know where he was at, somewhere around the United States, and my mom had lost. So I was in jail by myself. While I'm talking to you here today, you might hear me stutter, you might hear me like my words going in and out. I want to let you all know I'm not nervous at all. When I speak to you, I'm speaking to the same people that do the same work that I do. So you might hear passion, right? I don't want you guys to confuse nervousness for passion, right? That I have for this field, for the work, and just for people that we're saving today. So let's just make sure as you hear me stutter, as you hear a lot, don't think I'm nervous. Very much passionate about this work that we're doing. During my prison time, I still did not change my life. I did that 10 to 15-year sentence, and you know what? I was raised in a church, so I knew God, but I want to say I didn't know God enough to clearly do all the things that I was doing. While I was in prison, I want to skip through a lot of these stories and say, it was when I turned 25, 3 years into prison, that a young man doing life told me to come with him to church. And I went with him to church, and through time, I stopped doing a lot of the things that I was doing in prison. I stopped gangbanging, I stopped selling drugs, I stopped smoking cigarettes, I stopped smoking that K2 shit that they had going around the prison. I stopped doing all those things. On May 7th, 2016, I gave my life to God in prison. I got saved. From that point on, I went through my bid completely different. Thank you. Right. You're not going to be clapping in a little bit, though. So I got saved at that time, and I went through the rest of my prison. But I was in prison, and it's easy to be saved in prison, right? And we all know that. It's easy to get saved in prison, so there was no distractions. I didn't really want to be hanging around the Bloods and the Crips and all the gangs anyway. I just did it because I needed phone time, I needed to feel comfortable, and I needed to feel like I still had some kind of power. I was able to get rid of those feelings and go through and hang with a different crowd, the Bible wielders, whatever you wanted to call them. And I felt like, hey, I'm not hanging with you guys for safety. This is because my heart is telling me to do it. But again, getting saved in prison, very much easy. Got a letter from the New York State prison system, and it said, hey, you're getting released early to work release in another 2 years. Sentence knocked off. I said, wow, look what happens when you give your life to God. And I went out there to the world. After 6 years, 6 years I was back in the world. Long story short, y'all know what happened when I got back in the world, right? That's why I told you I don't clap yet. I wish I would have told you I don't clap yet. Because I went back in the world and I forgot God, right? That's exactly what I did. I mean, the moment that they put me back out, I forgot that. And I forgot everything I learned in prison. Because the programs that I did in prison were just, I didn't do the reentry stuff. I didn't do the mental health stuff. I said that wasn't for me. I don't think I got mental health issues. I got gang issues. And they didn't really have gang prevention programs. So my mind wasn't really realizing that mental health, all that stuff was why I was in a gang. I was in the gang because I had mental health issues, because I had all those things, but I didn't see that. So I went out on this work release program. I only had to sleep in the jail at night, but I had competing priorities. I haven't seen a woman in 6 years. I haven't smoked a joint. I can't smoke a joint. Let me go try this cigarette, see if it gives me the same feeling. It's just so many things that was going on in my head, but the main thing they wanted me to do was find a job, and God was with me still, so I found a job in 6 days, cleaning toilets at a gym called New York Sports Club. So cleaning toilets there, and I felt crazy doing this. I said, this can't be what I'm supposed to do. And I'm giving them my paychecks. They're giving me $50 every couple of weeks, telling me this is what lasts. So I said, you know what? I know what I do know. I know how to sell some drugs. Let me call somebody. Let me get some drugs. This should be okay. Got 70 days left on work release. Then they're releasing me early to 7 days out and just report to the jail once a week. This is going to be a beautiful thing. On day 30, before my early release, I walked into the jail. Somebody smoked K2 and kicked the CO down the stairs, strip searching everybody walking into the jail. I walked into the jail, get strip searched with a whole bunch of marijuana on me. I went back up to state prison. They maxed me out. Told me sit back up there. What happened when I went back to prison? I found God again, right? The wrong way to do it. Totally wrong way. Today I'm in a different place, but I knew it was the wrong way. But I had time again now. Now I had time to myself, all these different things. So we're going to skip along. I got out of prison eventually at 29 years old. And this time I had a lot more ambition and said, I'm not going to sell drugs anymore because clearly this is not working. And clearly I don't even know what to really do. I'm walking into jail and I just don't want to play this game anymore. I'm not even going to go back to the hood. One thing that I felt like was in me was I said, I'm not going to go back to the hood because the temptation is too much. How it makes me feel like I'm a winner. It makes me feel like I'm this king. There's women there that big up this lifestyle. And I said, I don't really want that around me. Let me actually just leave that alone so I'm not going back to the hood. Didn't go back to the hood. In New York, they got this crazy law that I told a lot of y'all about last night. You can't go back to a red zone. A red zone is anywhere there's drugs or crimes being committed. That's every place black and brown people live. That's where my aunt lived. So you can't go back there. That's why 44% of people are not homeless in New York when they leave prison, but they return to a homeless shelter. So I went to a shelter. Parole said, go do these reentry services, and gave me a piece of paper. And that's when it all started for me. I was like, why would she give me a piece of paper? She can't do something on the laptop for me. She gave me the paper. I called a bunch of the services. One told me that they do workforce development. And I was like, cool, that's the job. I called another one. They told me they do this, the healthcare thing. I was like, okay, good. I got to get Medicaid back enrolled in too. And I started saying, dang, I got to go to all these places though. I still got parole. I still want to see the chick that started writing me the last 9 months. I still want to do this. And I got a daughter that I never met who don't even speak English. So it's a lot of weird things going on, but I got to do all this and then everything they're telling me to do. And I didn't do it. I said, no, I'm not going to do this at all. This is where, I guess this is that thing where they talk about the system is broken. This must be what they're talking about. I'm not going to do it. I'm going to go get a job, though, and I'm going to stay in the shelter and work with the shelter specialist. Long story short, I got this thing called a one-shot deal where they pay your rent for 12 months. They give you $5,000 for furniture. And I was on public assistance for the first time in my life. I did that. That was the best thing that ever happened to me. During those 12 months, I was able to save up money. I was able to find a nonprofit called Defy Ventures that came to me in the jail, but I denied them because I was ignorant. And then I found them again. This guy, Terrell Hall, I always like to mention his name because I feel like he came to the prison, talked to me, he told me, you'll come back and change your mind. And then God brought me back to this guy. He found me. I went to the program, signed up. They gave me a laptop and said, what's your vision? What do you want to do? You got to be here with a business idea. I said, I don't really know. He said, take your time. I came back with a newspaper idea, corner store, gym. I sat in the shelter, looked at the ceiling. I got on this thing called LinkedIn. You're probably all familiar with LinkedIn, or you've heard of it. And I said, dang, this is really cool. What if they had this for formerly incarcerated people? Like, look at all these employers. Let me apply to these jobs. You're denied, you're denied, you're denied. Your background check. I said, well, LinkedIn was still great because I would never even got this far on anything else. So I got denied, but it got me further. I said, dang, I want to build something like this for people like me. How much would this cost? Let me start going on Google. $500,000. I said, forget it. This is just a dream. And that's why they call it a dream, right? I went to that entrepreneurship program. I told them, this is what I'd like to do. I'd like to build an app for a job board. They said, it's a great idea. Here's a laptop. Try to get to work, try to do some stuff. They taught me business. They taught me LLC. They taught me a bunch of different things about business. And after a year, I was a totally different person. Like, I knew so much about business. I knew so much about technology. They put mentors around me. And I started a company called Con Connect, right? We're not called that today. And before we go any further, you're probably saying, dang, you calling people cons? No. If you see the logo, it was called Con Connect, and then in the word con, there was a person walking out of it into the word connections, because I felt like we always just needed connections, right? So the company was called Con Connect, and I started it with $60,000 that I would have never got if I wasn't able to save the money from that one-shot deal. I didn't have to pay any rent. I was able to save money to start this business on my own. 1 year later, I got a call after many failed applications, after learning about this world called venture capital. Never knew what venture capital was growing up as a black man in the hood. People ready to give you millions of dollars to see if your dream can come true. And I never knew this. I only knew drug dealing. I knew about Big Meech. I didn't see people that dressed like how I dress today. I just didn't see that. So I did see drug dealers. I did see pimps. I did see all those things, and I felt like that could be me because those are the people that looked like me. But I never knew about venture capital. I never knew what a founder was, a person starting a business. I never knew what a startup was, none of those things. But now I knew, and I got a phone call from these people, Techstars. Techstars is the largest venture capital pre-seed investment firm in the United States. And I got a call from them and thought it was a scam. They said, hey, we found your idea on this website. Can you pitch to us? And I said, yeah, I'd love to pitch to you guys. I pitched them. Long story short, they said they wired me $250,000 and said, we need you to move to Atlanta. We want you to move to Atlanta. We're going to turn you into a young CEO. We promise you, but you have to do this commitment or we're not giving you the money. I changed my life, went to Atlanta, trusted that this was going to be the next best thing, and then it was the next best thing, right? I got $250,000 from them. 3 months, they turned me into a CEO, the person that I never thought I'd be. And I left out after that 3 months, I had about $2.5 million from investors. And these are my investors today, right? Decarceration Fund, Robinhood, DreamMore, Greta. If you guys maybe know Van Jones, the CNN anchor, Van Jones has gave me $200,000 personally to continue this money. This is not to brag, this is to show you the change, right? I'm on billboards across the United States for the work that I do. We're gonna go into that work later on, or I'm gonna be able to talk and build with you. But after that 4 months, I was able to raise about $2 million, take our company ConConnect across 400 employers across the United States. What the company did was we read your background check. We used AI, we read your background check. If you were a bank robber, you weren't gonna see jobs at the bank. If you had burglary, you weren't going to be installing Wi-Fi for Verizon. Those people can't come in your house. We learned that it wasn't you needed to be a second chance employer because New York Sports Club is not a second chance employer. My background just didn't conflict with me cleaning toilets. It's all legal AI, machine learning, and this is years ago before AI became a thing, right? And this is what we're doing today. So I want to skip in because I know we're on time, and I want to go into the crisis and why reentry fails, right? And you guys know all of these statistics already, so I'm not gonna sit here and preach already the things you know. I'm gonna talk about some things that are under the bullet points, right? So 600,000 people released annually. Each caseworker, each nonprofit staff member in here, you would have to have a caseload of 163 people to actually do the work. You probably cannot do that. You're gonna hear me say some hard things. If you're in your head, you're saying you can do that, then you're in your faith and that's really good. Realistically, 163 people caseload, you can't handle that. Therefore, you can't really solve the issue that you're trying to solve. Limited housing. You would have to have at least 200,000 landlords across the United States say, we are now opening up the doors for people to come live in our places for us to actually solve the housing crisis. So if we don't have a plan to get 200,000 landlords to say yes, then there really is no plan unless you guys are all going to build the houses and get the money to build the properties. If you can't get the money to build the properties, then the influence needs to be towards landlords, not any other program, right? And I also want to say you might hear some things that conflict with your thought process here, right? This is not here just to be a keynote and to have everything agree. It may conflict. You may not fully agree with me. But I do want to tell you that we're all aligned on the same page because I want the same things you all want. We may just want it different ways. So I'm here just to show you some of the different ways and some of the ways that I think about it and some of the ways that our money, our research, and what it has brought us, right? So HIV rates. I'm sorry for the words not being spaced out, but thousands re-enter without untreated conditions. What does that do? Strains community health systems. It spreads the viruses across the United States. And we're going to go into some more data. So just keep it to Illinois, right? Here's your, each caseworker, each nonprofit, I use the word caseworker, but we'll just say nonprofit staff member. You guys would need have to have 152 clients annually for effective reentry support. To close the gap, Illinois needs 15,000 fair chance job opportunities annually. So you need 15,000 livable wage jobs opened every single year for you to get everybody back into a job that's with a livable wage. So we're not talking about 15,000 just jobs. 15,000 livable wage jobs is what you need access to every year. So you would have to make a game plan to make sure at your fiscal, hey, if we're servicing this county, how many people are coming home? All right, do we have the amount of jobs? If you don't, then you're planning wrong. To prevent a public health crisis, you would need 450 plus pre-release medical appointments. So people within prison, they would need 450 appointments scheduled early for you to actually solve the whole medical appointments, expanded post-release, healthcare access, get people the treatment they need. you would actually have to get them an appointment 6 months release. That's not happening for everybody. People are not getting appointments 6 months release, and this is the data for Illinois. This problem is across the United States. This whole healthcare problem, the HIV, the caseworkers, there's caseworkers everywhere. That's why I said we have national data, then we brought some data for you guys here too as well, right? Without stable housing and jobs, nearly 13,000 people are gonna return to prison. Again, focus on the things you need, 15,000 jobs annually. Caseworkers, it's impossible, so we're gonna go into how caseworkers can actually hit those numbers, because either you're hiring more caseworkers at whatever you're gonna pay them, or you figure something else out, and I'm gonna show you what what we can figure out. So going into the health crisis, incarcerated individuals in Illinois have an HIV rate 5 times higher than the general population. To combat this, at least 2,500 pre-release medical screenings would be needed annually. That's also not happening in Illinois. It's just not happening at all. Post-release gaps. Without continued medical care, many face delayed treatment, worsening health outcomes, and increased community spread. Right? So unless the prisons or docs or government says, hey, we're gonna start sharing health records, we're gonna start automating this, we're gonna use some kind of technology to get these people scheduled appointments, to get you their data across, then we're gonna continue to have community spread. There's gonna be conversations about it. We can have conversations like this, we can have keynotes, we can have workshops. There's only one solution that's gonna actually automate the process of data getting sent across the right stakeholders who need to know what this person has so we can get them the right appointments and all that kind of stuff. Delayed care affects 50% plus people post-release. So this is a slide I don't typically see, when people are talking. So we talk about a lot, like all the data, all that kind of stuff. But you guys, right? You guys doing the work, right? These are all AI stuff, but these people are burnt out. These people are burnt out, they're tired, they're working hard, because a broken system doesn't just fail clients, it fails the people working to change it, right? So the system hasn't just failed your clients, it's all failed you guys. Some of you maybe work on spreadsheets, some of you probably work in Salesforce, Bontero, all these case management systems. What do they do for you? They remind you your client's name. They remind you how much work you have to go do. Okay, John has 7 needs, this client has 15, great. It doesn't help you go get the needs done, you go do it all yourself. So the system isn't just failing your clients, it's failing you as well, right? High case loads, underfunded programs. The biggest thing, which I really wanted to put this as number 1, because we're always gonna have high case loads, people are going to prison, people are gonna continue to get disease, we can make things better, but we have to be realistic. People are gonna continue to go to prison, and prisons are not closing anytime soon. That's just not the reality. So organizations failing to evolve is actually my number 1. Since we all know prisons aren't closing, since we know there's a health crisis, why are we not evolving? That's the only thing we can fix is us at an organization level. You can control your organization. So that actually, it should be number 1, and then inefficient workflows was my number 2. The workflows we have to solve some of these issues, to get client services, to make sure they're good, are inefficient. A lot of nonprofits I speak to work like it's still 1970, and it doesn't make sense to me. And I ask them, why do you work like that? How does that solve your problem? Because I just want to ask those questions, because a lot of times I'm curious. I need to know why they still think like that. Maybe I'm missing something. I've been out of prison since 2020. It's only 2025. I could be wrong. I've been a caseworker for only 9 months, and I quit because I hated it. So I like to listen and learn. Maybe I'm missing something from these individuals on why they feel like they should email a referral to a busy organization who has overwhelmed case management, who has this and that. It doesn't make sense. Therefore, is a system failing itself. And if this resonates with you, then I'm happy, because that means we're getting somewhere. I'm gonna hurry up and go over this, right? The disconnect in reentry services. It's just a fragmented system forcing returning systems to navigate disconnected case management. If we're disconnected and we don't have nothing that brings us together, then the client is disconnected, right? If we're disconnected, client is disconnected. I'm in New York, and I'll just use New York. I go to events, and I'm at the table, and I'm like, hey, where are you at? I'm right down the street. I'm like, oh, you're right down the street from me, and we don't know about each other. Don't even make no sense. You provide healthcare, I do workforce development. I've been telling my clients go on New York Healthcare, Medicaid.com and do all these things, right? Outdated systems. A lot of nonprofits work off a system not made for them. I'll just use Salesforce. Sales, you're not doing sales. That's it right there. It's a system that they made a piece of and said, hey, nonprofits do need some kind of thing where they can manage people. Let's give them this, and then they'll have the hardest time trying to use it, missing data, gaps in data. There it goes to an inefficient system, an inefficient program, outdatedness. Lack of real-time data sharing. Without integrated reporting, providers fail to track clients' health. Clients leave programs after a 6-month program, and then we say, great, this client is great. A lot of times, 3 months later, that client's back struggling, and you don't even know that. And you run the same program for 5 years because you don't really know the real data behind your program. You don't really know that those people I done left out and they done relapsed, they went back to doing this, they done did that. That's the real things that we got to talk about. Hey, how good is this program we have? We've been running it for 5 years, but we don't even know what happened with John Doe and Jane Doe. Are they married? Is the quality of life good? Did they have kids? Did they move a house? Is the credit score above 700 yet? Did all that happen for them? Or did we get them the job at Walmart and we knocked them off in the data and we said they're good to go? And then just the gaps in health and workforce support. So we'll take a moment to reflect here, right? What keeps people from truly succeeding, right? And this is I'm not going to answer this. This is for you to ask yourselves that. And when I say ask that, ask this to yourselves, but ask this about your clients and the people that are around you, right? What keeps them from truly succeeding? And then, what keeps us from doing our best work? And again, this is for you to just think about it, right? Because this could be a bunch of things. So these are not answers. These are a bunch of things. It could be the organization you work at. It could be an outdated system. It can be you have the wrong tools. It can be you don't have enough tools or you don't have any, because nonprofit, technology, we don't hear that enough in the same sentence. You hear nonprofit, human, social worker, caseworker. You have the hardest job in the world is helping people, but you don't use technology. So you're telling a human to help people who are on drugs, just came out of prison, got the craziest mindsets, all this shit going on in their life, and we're telling a human who still battles at home with their things going on in life, their husband, their wife, their kids, everything stressing out to go, help this one individual, or actually not one is a crazy number, go help this 30 plus individuals. Go help them, and we know you got your problems, but go help these 30 plus individuals with their own problems because you are a caseworker and you got some kind of certification or your MSW. It don't really make sense. So what keeps people from truly succeeding and what keeps us from doing our best work, right? I don't know how this came out like that, but who's to blame? But I do know what it says. Yeah, I don't know why that came out like that, meaning the words were over there, but that's all good. Who's to blame? We're always blaming somebody, right? It's okay, we're humans. We're always blaming somebody. We're always trying to figure out, like, who's to blame? Is it the funders? Is it the government? They didn't give us the money. Our clients are struggling. It's always a bunch of things, right? We're trying to blame somebody for stuff. So it goes back to my first slide on what can we do? If we can't get money from the government, like I said, we know there's a terrible problem, right, going on. Elon Musk is doing terrible things in the United States right now, and the consequences are going to be drastic. So because we all know that, you just said it, we all know that, what are we doing? I'm not going to blame Elon Musk, because if I sit there and blame him, my clients still don't get served. If I blame my executive director because I'm on a spreadsheet and I can't even see a report, my clients don't get served. I work 10 times harder because I'm on this tool. So my clients don't get served, I work harder, the impact is low. Doesn't make sense. It doesn't make sense. My clients, is there, what does this one say? Is it the funders? Perfect thing. Is it our funders? Are we expecting impact, or as an organization, do we expect real impact without investing in better tools to better ourselves, right? And I'm going to skip over to this slide. What is the solution? I am a technologist, people. I am an ex-caseworker. I went to prison for about 6.5 years, then went back for about another 1.5 years. But what my trade is, what my education is, what I am a professional at is nonprofit technology. That's why I get the amount of money we get per month to do the research and the stuff we do. Again, we are the patient management system for about 4 hospitals. We are the correctional management system for 172 correctional facilities across the United States. And then for nonprofits, we work with about 400 of them, right? So eliminating their outdated systems to where we don't just bring AI. AI is just for the picture. Do not get scared about, oh, what is this? Is this an AI thing? No. Humans plus technology equal impact. You cannot handle a 150-person caseload. Therefore, you need technology. You cannot get a person a job referral, help them with their health stuff, try to get them the mental health thing, make their appointment, help them get back to their appointment, follow up. You can't do that. Smart case management can do that. Technology can do that. You're a human being. You're supposed to do what a human being's supposed to do. You provide empathy, right? Because a AI robot can't provide empathy. You provide empathy. You provide the conversation. You provide the initial guidance. Technology makes your referrals. Technology writes your case plans. Technology follow-ups with your clients. Technology puts a calendar appointment. Technology does their applications to the doctors. You provide empathy. You talk. You support. You preach to the next group of people you want to service. You don't do all the other things because you're a care provider. You are a social worker. You're a case manager. The words will confuse you and make you feel like, oh, case manager, I manage the whole case. It's not meant to be that. It is just stuck in an age that, and we're in 2025, so we need to bring it there now, and it will look different. Solutions, and we'll go over this, right? I want to skip through this, but smart case management, automated job matching, client portals, and just go into this real quick. So this is just a screenshot. Cruz Maridela Cruz, she's a justice impacted lady, right? Through a different system, right? Just through technology, I see that she was accepted as an EMT for a job. I see pending pediatric appointment. I see Starbucks also hired her. And this is just a screenshot, but now I can click into that EMT position and see when she got hired, salary. Pediatrics, I can click into pending, when is the actual appointment, and if any documents or anything is needed for the doctor, for the EMT, like if the employer wants a resume, the credentials, the license, because it's all in my system, it's gonna send automatically, right? And I'm just clicking on a button and I'm just tracking all of these things. I didn't do a referral to the EMT. My system said the client's unemployed, she has these skills and this is her dream. Let me find the nearest job, doesn't conflict with her background, referred it and spoke to HR for me. I just sat down and spoke with more clients and served more people because my time was saved. Advancing health equity and reentry. AI-powered Medicaid and benefits enrollment. Do you know technology can just enroll your clients in Medicaid for you? Do the follow-up, do the whole 9 yards, right? Probably still sitting down doing this and then trying to wonder, hey, the client didn't get Medicaid, the follow-up didn't go through. I mean, because you're doing it. You're a human. You're trying to remember 1,000 things to do. Again, some things just don't make sense, right? Smart health records integration. A lot of technology out there. I can go into my system and go and just log in and see the records of 400,000 people because we're the system for the United States tablet system. All the tablets in prison, we're the ones on there. We collect the health records, the data, the services they need. We can see this. It's just technology. It's not a human that can have that much insight to 400,000 people. Predictive health risk alerts. Technology can tell me, my Apple Watch can tell me if I'm gonna catch a stroke. It's all technology, right? And that's a different use case, but there's so many things. Learning about a client, putting in their mental health diagnosis in a system, and then having AI predictive at what they need to actually stay healthy. What could possibly happen in the future, right? Then digital health navigation. There's so many tools out there where people can get on. I can get on, I speak to my therapist digitally, I speak to my doctor digitally, I check my records digitally, everything is on my phone to make my appointments. All of these kind of things are in one place. I'm nobody special. A CEO didn't give me access to this. I had access to all these tools as a regular person in the shelter. I just unfortunately, I learned it all myself just through Google. So the future of reentry and health with AI. AI is going to transform the reentry and healthcare, right? So you can wait for companies to come in here and do it that you are all not familiar with, that are not impact driven, and they will build you the products that they think you all need, and then you will be forced to use them because times are going to advance. Reentry 2030, what do you think that's all about? Reentry in 2035, do you think the manual thing is going to last forever? You all have to voice your opinions on what these tools and technology can do for you all, for your clients. The same problems you all talk to amongst each other about, talk amongst it and now add technology to the equation. Hey, if I can do this, what can technology do here? Could it streamline this? The more you guys talk about that, you don't have to build it yourselves. There's companies that are doing good that will help build these technologies, but you have to voice the opinion or you will have another sales force make you something that they think you all need and then it will not work. Predictive analytics for caseworkers, cross-systems integrations. Eventually, all your systems will connect. You don't have to worry about a government system not connecting. We know they're not going to give access, so don't worry about that. Take it in your hands to get your own system. Systems can connect. You can connect health to health record systems. You can connect to other organizations. You can have your 5 community partners and have connectivity in one system. You just have to have the right system that does it for you. Team, this is for me to stay connected with you all. This is just access to my LinkedIn, my email, if you're all on LinkedIn, for us to stay connected, because unfortunately, I'm gonna have to run and catch a 12:30 flight after this to Boston to do this, to do something else. So I want to stay connected with you guys. I want to make sure that we are doing the same work. I want you to be able to ask me questions, things you don't agree with, things you do agree with, and let's just continue to have that conversation too as well. I'll keep that up for a minute before I go to the next screen. I'll get that over. Is it just not working? It worked for, it seemed like good. Gotcha. This is if you just want to learn more about the technologies that are out there, right? So this is if you just want to learn more about the technologies that are out there, from all the stuff that I talked about, client portals, this and that, or any of those kind of things. We give guides, we do free workshops, we do all of these kind of things at Untapped Solutions for nonprofits, government agencies, where you can come in, we can show you how to use tools. If you're on other systems, we can show you how to use them better, build them out, better to manage the actual work you're doing, so you're actually doing less and not more. Thank you for your attention. Thank you for your time. And I appreciate the work that you all do.